Good afternoon, everyone. Thank you for joining us for a briefing on the Department of Health's guidance on veterinary practices amid the COVID-19 pandemic. I'm Jennifer Keeler, Executive Director of PVMA. I'm joined this evening by Dr. Betsy Schrader, who is the State Veterinary Public Health Veterinarian in Pennsylvania's Department of Health. Dr. Schrader is a graduate of Notre Dame. She received her Master's of Public Health from the University of Minnesota and earned a joint degree, doctorate degree in veterinary medicine and biomedical and veterinary science from Virginia Medical Regional College of Veterinary Medicine. Before joining the Department of Health, Dr. Schrader worked as an Epidemic Intelligence Service Officer for the CDC. Dr. Schrader, thank you for joining us tonight. As you know, we have a lot of questions from veterinary professionals on the limitations placed on their practices during this pandemic. I know you have a presentation that aims to give some clarity to everyone. So tonight's agenda for this webinar is for Dr. Schrader to share her presentation, and then we will go through all of the questions that we had submitted to us through the PVMA website in advance of this webinar. We're not taking any live questions tonight. If you do have a question that comes up during the webinar, just go to our website, pavma.org, and submit a question, and we will make sure that Dr. Schrader or the appropriate person can answer you. Dr. Schrader, with that, I'm going to turn things over to you.
Okay, thank you very much. Give me 1 second. You know what, Jennifer, looks like my participant screen sharing has been disabled.
Oh, that's not good. Let me get that for you. Let me check with Megan. Megan, do you know how to turn this on? I don't see.
Let me.
What I can do, Dr. Schrader, I have your presentation, so I can just pull that up and share
it looks
it
like
on my screen.
Nathaniel Oster had a comment in the chat that might help.
Okay. Oh, there we go. I did get your, there you go. And you are set on the screen sharing.
There we go. Is that better?
We've got it.
Okay, great. Well, thank you very much. Good evening, and thank you to PVMA for giving me the opportunity to talk to you today about the guidance for veterinary practices during COVID-19. A little bit of background, COVID-19 is caused by a coronavirus called SARS-CoV-2. It is a positive sense single-stranded RNA virus, and it is related to the viruses that caused the severe acute respiratory syndrome pandemic, SARS, in 2003, and the Middle East respiratory syndrome epidemic, MERS, in 2012. COVID-19 is caused by, I apologize, COVID-19 is a respiratory disease that is spread primarily through droplets from sneezes or coughs. Approximately 80% of people will experience a very mild case, usually limited to a mild fever, some upper respiratory syndromes, but about 1 out of every 6 people who become infected will become seriously ill, and that can include hospitalization, requiring mechanical ventilation, or even death. Elderly people and people with underlying medical conditions are at higher risk for having a severe outcome of this illness. Now, when it comes to animals, there's still a lot we don't know about SARS-CoV-2. We know it originated from a still unknown animal source. There is no evidence at this time that animals play a significant role in transmission. There is, however, a potential risk for animals to be infected with SARS-CoV-2 from humans, and in fact, we have seen a number of cases like that. There have been a handful of confirmed cases of COVID-19 in animals, including 2 dogs and a cat in Hong Kong, 2 cats in New York, and 4 tigers and 3 lions in the Bronx Zoo. There have also been additional reports of other dogs and cats being infected with SARS-CoV-2, but those results have not been confirmed. All animals that are that test positive for SARS-CoV-2 are having confirmatory diagnoses being run at NVSL in Ames, Iowa. So that's really what we're talking about when we're talking about confirmed animals, is those that have been confirmed at NVSL. Additionally, there's been some interesting information coming out on mink and COVID-19. A pre-printed article that was posted on May 18th. So this is an article that has not been subject to peer review, but is being put out nonetheless. Detailed an outbreak of SARS-CoV-2 in 2 mink farms in the Netherlands. The overall mortality rate was around 2% of the farmed mink, which was much higher than expected in a year that did not have SARS-CoV-2. The usual mink mortality in these farms for this time of year was about 0.6%, so significantly higher. And it is interesting to note that this is a animal where we are seeing mortality. These mink had some of them had mild respiratory symptoms. Others had pretty severe acute respiratory distress, and a significant number of them did die. At least one person on each mink farm was diagnosed with COVID-19, and it was thought that that's how the virus was introduced to the mink. It's also thought that there was significant mink-to-mink transmission. This is interesting kind of from a research perspective, because there was some evidence that SARS and ferrets were thought to be pretty well adapted to each other back in 2003. And so this does kind of fall along similar lines. Mink appeared to be the animal that are currently most, hardest hit by COVID that we're aware of right now. On May 8th, guidance was put out by the Pennsylvania Department of State, and this guidance was developed in conjunction with the Pennsylvania Department of Health, the Pennsylvania Department of Agriculture, the Pennsylvania Department of State. And when we were developing this guidance, we did draw on several external subject matter experts who had a lot of experience in veterinary medicine, both from a private practitioner perspective and from a regulatory perspective. And it's worth noting that at the time this guidance came out, the entire state was under stay-at-home orders. This guidance stated that veterinary medicine is life-sustaining business, and the Pennsylvania Department of State temporarily adopted the AVMA guidelines as standards of care. Additionally, they also suspended requirements for telemedicine and for reactivating retired practitioners. And veterinarians were instructed to delay non-essential procedures, including spays and neuters, wellness exams, and most routine vaccinations, with some exceptions. At roughly the same time, the governor's office came out with their tiered reopening plan. Counties were lumped into red, yellow, or green categories. Now, and as we're talking about this, and going forward, I do really recommend that you refer back to that guidance for updates as different counties move from color to color. Counties in red are essentially operating under the same parameters as were described in the AVMA guidelines, or in the guidance that came out on May 8th. That being said, after several weeks of being in red, specifically in the Southeast, I know you guys have been red since early March. Some procedures that were non-essential back at the beginning of March might be more urgent. But we do still recommend using the AVMA guidelines as standards of care in red, recognizing that what may be essential, that what might have been non-essential before might be more essential now. Yellow is where it starts to get a little fuzzy. The language in the guidance document says to use, quote, your best professional judgment in determining the patients that can be safely seen in the clinic and those that can be treated through telemedicine, and practices should maintain the social distancing standards already in place. When you decide to go forward with the procedure that you might have deferred when your county was in red, my advice is to document, document, document. If you can point to your records and say, this is why I decided to move forward with that procedure, that will go a long ways towards making sure your decisions are in line with the guidance if there's an issue. Additionally, some counties will be going into green soon. I really want to highlight the green does not mean back to normal. I have no idea if or when we'll get back to, quote, normal, or what normal will look like. The guidance for veterinarians in green is similar to that in yellow. Use your professional judgment regarding the need to do a procedure, balancing it against the amount of disease in your community, with the aim of protecting not just your health, but the health of your staff. The guidance for businesses in green counties are to operate at 50 to 75% capacity and where possible, only take appointments. Part of that model does work for veterinary practitioners, but you'll have to adapt it to what works best for your practice. But those are the guidelines that are put forth in the governor's plan. For your business, and as part of the guidance that the governor's office has put forth, it is recommended that you have a plan to protect employees that would be at highest risk. If you have employees that are immunocompromised or have some underlying medical conditions, consider having them perform duties that would minimize contact with owners or other staff, for example. Continue to adhere to social distancing, proper cleaning, hand hygiene, and protecting your employees' health. And don't forget break areas. Those can be sources of transmission. We've seen that in other work environments. Implement temperature screening for employees and ask about symptoms before coming into work. If an employee isn't feeling well, they should be encouraged to stay home. That's one of the biggest sources of transmission within a workplace. I'm not sure if anybody saw the news out of Missouri, but it was I believe it was two hairstylists who managed to expose over 100 people because they came to work sick. We understand why people want to come to work sick. It makes sense, but it really is important to communicate with your staff that if you aren't feeling well, please don't come in. We show up to work when we're feeling lousy. That's something veterinarians do a great job of, but unfortunately, that is a great way to expose and infect a lot of people. And finally, be informed about the COVID situation locally and across the state. The situation has continued to evolve rapidly, and you will need to be able to make decisions based on up-to-date information. You know, we're having counties go from red to yellow, yellow to green. There's a possibility that counties might go backwards from green to yellow or from yellow to red. And so really knowing what the circumstances are in your local community is really going to help inform the best practices that you can have. The recommendations for veterinarians during COVID, especially as we move into yellow and green phases, is to reframe the thinking so that it's less about what specific procedures you can do, but how you do them. You know, we've been seeing over time as we learn more about COVID, is that the risk of getting infected with COVID is a function of time, distance, and shielding. If you minimize the amount of time that you're exposed to somebody else, if you are more than 6 feet apart, and if you're both masked, then all of those will decrease the risk of transmission. Where possible, use virtual or telemedicine. If possible, do work outside. Be prepared to exclude close contacts of a confirmed case. Someone is considered to have been a close contact if they were within 6 feet for at least 10 to 15 minutes, and those close contacts should quarantine at home for 14 days after their last exposure to the case. And finally, do things that will minimize the risk if you or your staff are exposed. Encourage masking of staff and owners. Stay at least 6 feet apart, and mandate good hand hygiene among staff and yourself. And finally, please stay tuned for future guidance. Again, we are learning more about this virus every day, and our guidance does change based on that new knowledge. Sometimes that guidance comes at the speed of government, but we are continuing to review and update this information as best we can. And finally, please stay informed about what is happening in your area. The Pennsylvania Department of Health and the CDC are continuing to update their websites, and those should be your primary source of information. Speaking of some of those resources, here are some resources that are both Pennsylvania specific, including more information about the reopening plans and nationally, some good guidance specifically for veterinarians and also for decisions that can help guide some of the stuff you do in your workplace. So thank you very much for your time. I know that was a pretty brief overview, and I know that there's still a lot of questions, fully recognizing that, this is, none of us have ever had to work through a pandemic before. And so we really are trying to use the best science to try to make the best recommendations to protect not just the health of you and your staff, but of the community at large. And so for that, I can answer some questions.
Thank you, Dr. Schrader. I've condensed most of the questions that we received because they fell under some general categories. So I think the question that we have heard the most, I will start out with, which is about elective procedures, specifically spays and neutering, and when they can start being scheduled and how to handle elective procedures through this phased opening.
Sure. Yeah. Thank you. And I know that's been a huge question mark, and I know it's been a confusing process. And the challenge has been trying to balance protecting human health with providing the services and care that you normally do. The restrictions that we put out on May 8th were really based on a number of factors, and this was really what we were recommending even before the guidance came out on the 8th. And those factors included the availability of PPE and the amount of risk in the community. Now, as the pandemic evolves and as the outbreak response evolves as well, both of those variables can change. As of right now, to the best of my knowledge, the PPE supply is in better shape. The other variable, the amount of community transmission, is less within our control, although we wish it were. Currently, my advice is that since the PPE supply is a little more stable, as you go into yellow and green, the specific procedures you do matter less than the steps you take to protect your staff and making sure you adhere to the governor's work setting restrictions for your county's phase. Spays and neuters, like if you decide you want to go forward with that, that's great. Recommend though that you stick to using social distancing precautions, as we discussed in the presentation. And really, no matter what the phase is, again, risk is a function of time, distance, and shielding. So in yellow and green, use your professional judgment. Document why the procedure is necessary. Schedule those postponed procedures from earlier, and limit the number of people you and your staff come into contact with. Maintain 6 feet of distance where you can. Wear your mask, and do your best to minimize the risk to you and to you, your staff, and your clients.
Great, thank you. That kind of brings us to a lot of the questions we got are about the physical aspect of practicing veterinary medicine and keeping staff safe. So next question is, what are the guidelines for staff if a staff member tests positive for COVID-19?
Sure. Yeah. No, that's another great question. And before I answer that question, please forgive me with a little bit of digression into some terminology. When somebody tests positive for COVID-19, what we at the Department of Health are concerned about are what we call close contacts. You've heard a lot about contact tracing in the news. That's really what this boils down to, is contact tracing is trying to identify these people who are close contacts of a confirmed case. Close contact is defined as being within 6 feet of a person infected with COVID for at least 15 minutes. The time period where that close contact really matters starts 2 days before the person with COVID-19 becomes symptomatic until that person isolates. So if you see somebody on Monday and they start to develop symptoms on Tuesday and they test positive on Wednesday, then you were potentially exposed if you were within that 6 feet for more than 15 minutes, even though they didn't have symptoms when they saw you. That's really been the unfortunate thing about this virus, is that it feels like every time it has the opportunity to make our lives harder, it does. And so that's really been one of the, I said we're learning more about the virus every single day, and that's true. And really, the fact that there is asymptomatic shedding really, caused a lot of stress and anxiety here at the Department of Health. And so that's why the contact tracing really goes back to 2 days before that person is symptomatic. And so please keep in mind that, as we're learning more about the virus, that definition of what a close contact is can change. So keep an eye out for updates to CDC's website or the Pennsylvania Department of Health's website, because, we are learning more and more about the virus every single day, and it really is thought to be like a 1 15-minute chunk. I just want to make that clear that, if you see somebody, 3 times, for 5 minutes at a time, that's a lower risk exposure than sitting across the table from somebody for 15 minutes straight. So to actually get back to answering the question, if a staff member tests positive for COVID-19, the safest approach and to protect their staff and anybody else from being continuously exposed is to quarantine anyone who is a close contact of that staff member. These are also the guidelines if you were to find out that a client tested positive for COVID-19 after interacting with your staff while they were infectious. So for anyone who is a close contact, so again, that's within 6 feet for at least 15 minutes, starting with 2 days before that person became infectious. For anyone who was a close contact, of someone with COVID during that infectious time period, we are recommending that those close contacts quarantine at home for 14 days after their last exposure. That 14-day window is based on our understanding of the incubation period of the virus. So, to the best of our knowledge, the maximum incubation period after you've been exposed to somebody with COVID-19 is 14 days. And so if a person quarantines at home 14 days after they were exposed to somebody and they don't become sick, then we can feel reasonably confident that that person was not infected with COVID. If the person being quarantined develops symptoms, then they should get tested and contact their healthcare provider. Additionally, things like diligent hand hygiene, good cleaning, and disinfection practices, especially focusing on surfaces and shared areas, should be done if one of your staff tests positive. And you should also communicate with other staff that somebody tested positive while balancing the privacy of the case. I know that can be a difficult situation to kind of navigate, but it is important that members of your staff know if they were exposed to a confirmed case of COVID. And again, I come back to please encourage your staff to stay home if they feel ill. The virus can be, it's especially tough this time of year with allergies and recognizing that, but it's really important to kind of keep an eye on how you're feeling. And if you feel sick, please don't go to work that day. That is one of the biggest things we're seeing with this virus, is that at the very least at the beginning, people don't feel sick enough to stay home. And so really trying to get that message out that if you feel sick, think twice about going into work.
Great, thank you. Another question regarding people in the office is there an absolute mandate regarding vendors in hospitals currently?
There's not a mandate per se, but it's recommended that you take steps to protect your staff from potentially being exposed. And if they are exposed, decreasing the risk associated with that exposure. Again, you guys are probably tired of hearing me say it. Risk is time, distance, and shielding. So if you're in an area where there is not a lot of community transmission, the vendor is masked, the staff member is masked, and there's at least 6 feet of distance between you, and everybody washes their hands, and nobody shakes hands, then I think that that's a reasonably safe way to conduct business with the vendors. That's consistent with the science that we're aware of, recognizing that that could change. And so please continue to stay looped in for additional guidance.
Thank you. At what stage should the clients be allowed to come in with their pets for examination safely? And how do you propose that practices do this?
Yeah, again, I wish there was a straightforward metric that we could monitor and say, yep, it's definitely safe to do X, Y, and Z now. I know it's not always easy to do curbside service, especially with anxious animals. And no matter what, the answer that I give or the advice I give is going to be imperfect. Use your clinical judgment, document that judgment, and think through how your client can best function while you protect your workforce. The question that I'm encouraging people to think about is, if someone calls you and says that a client had COVID and they were infectious while they were at your hospital, how will that affect your workforce? Will you have to exclude a bunch of people because they were within 6 feet of the case for more than 15 minutes? Will your staff be even more protected because everybody was wearing a mask? Will somebody be at higher risk of having a severe outcome because they had close contact, didn't wear a mask, and they have underlying medical conditions? Risk, again, function of time, distance, and shielding. These are the policy decisions that you can make for your clinic or hospital based on what makes sense for you and your staff. Encouraging you to use telemedicine where appropriate, but recognizing that that's not going to be a one-size-fits-all solution. And so really, truly thinking through, with your staff about what will work best for us in our clinic and our practice. Again, I keep coming back to, if you found out tomorrow that you were exposed to somebody yesterday, how comfortable, how confident are you going to feel? How secure are you going to feel? Recognizing that, you had policies in place that would protect you and your staff.
Excellent. That's really a good way to frame how to answer, thinking through that question. So thank you. And I think this is the last question, and it is, what questions can we ask pet owners about their own health and their potential exposure to COVID-19?
I did check with our lawyers on this. Before people enter your clinic, if they will be entering your clinic, then yeah, you can ask about current symptoms, and and we would encourage you to. The symptoms, again, we are learning more about the virus every day, and the symptoms that we in CDC are primarily focusing on are, are you experiencing a fever, chills, cough, shortness of breath, fatigue, sore throat, or loss of taste or smell? If somebody, whether it's a vendor or a client, or even your staff, I would encourage you to ask people those questions before they come in. And you can also ask if someone has been, if they have been diagnosed with COVID-19 within the last 14 days, or if they are a close contact or a household member of a known COVID-19 case within the last 14 days. That's all part of, kind of good screening that the governor's office, has really been trying to put out over the last couple of weeks, is asking that information, trying to, that's all part of taking steps to protect you and your staff. And so I think those are reasonable things to ask. If somebody pushes back and says that's none of your business, I would also have a policy in place for how to handle that. Unfortunately, I can't tell you what that policy should be, but I think it's important to kind of think through some of those questions.
Great. Thank you so much. Again, if anyone has any questions, we aren't doing any right now, but you can ask them on our website at pavma.org. It's on our screen, and we will make sure that you get an answer. So thank you, Dr. Schrader, for that. We appreciate you taking the time to answer our questions tonight. It was very helpful. Some housekeeping notes. We will be providing a recording of this event on pavma.org in the next couple of days. If you have questions, again, please make sure you send them through our website and we will get the answers that you need. And also, keep checking our website and reading the email updates, whether it be Vet Bites or any blast emails we send out regarding any future upcoming CE events. We have some free CE webinars that we will be posting our registration for in the next couple of days, so you want to keep an eye out for that. Thank you all for spending some time with us this evening. I hope it's been helpful and helped to clarify some of the questions and concerns that you had as we move through the reopening of Pennsylvania. Have a great evening and thank you.